Hello, everyone, and welcome to the special Uplifther conversation. I'm Ayushi Dubey, and today's discussion is very close to our mission here at Uplifther to create a space where women's experiences around mental well being, dignity, and work related challenges are understood with both empathy and care. We're honored to have Dr. Kiran Pindiprolu here with us today. Dr. Kiran Pindiprolu is a consultant psychiatrist in the UK National Health Service and an honorary senior clinical teacher at the University of Sheffield Medical School. After completing MBBS from Calcutta University and MD in psychiatry from Institute of Mental Health, Hyderabad, he went on to become a member of the Royal College of Psychiatrists UK and completed his specialist training in general adult psychiatry with endorsement in rehabilitation psychiatry. As a rehabilitation psychiatrist, he's passionate about helping people with complex and long standing mental health difficulties, as well as rebuilding their lives in the community after long hospital stays. What drives his work is a genuine belief in the power of the doctor patient relationship and how meaningful, trusting connections can shape recovery. He also enjoys teaching the next generation of doctors, working with both undergraduate and postgraduate trainees. Outside work, he enjoys running with his dog, playing badminton with friends, and trying to build better routines. He's still working on fitting in regular exercise and carving out more time to practice the tabla, a skill he does not want to lose. Dr. Kiran, thank you so much for taking the time to speak with us today.
It is my pleasure to be here, Ayushi.
I'm really looking forward to learning from your perspective today. The questions we'll be discussing here are real concerns and stories shared by women at Uplifther, and I'm grateful we're able to explore them under your guidance. So I'll begin with the first one. Dr. Kiran, when you look at the people you work with every day, what are some of the things you feel most commonly shape their mental well being? I'm interested in the patterns you tend to see today.
That's a very broad question. As you've kindly introduced me, I work with people who are under secondary mental health services, people with highly complex mental health problems. But the vast majority of people with mental health problems probably don't even come into contact with services. So my answer is going to be more broad-based in terms of the first one is role of social media. So as much as social media is an enabler of connection, sense of belonging to communities, and access to information, it can also be a place where people are comparing themselves to others for the wrong reasons. And it can be a place for cyberbullying, for example, and for people to be exposed to harmful and unrealistic content. So all of these things can create a sense of lack of self-worth, anxiety, and feelings of inadequacy amongst people, and they can people to become mentally unwell. I think adolescents are particularly vulnerable to this. The second factor I would like to talk about is migration. And again, migration can be due to many reasons. If we pick a planned migration, for example, for someone's education, improving their life prospects, employment, and so on, that is very positive, but with it comes a big change in people's lives, a new language to learn, a new culture to adapt to. There can be challenges around finding the right kind of work. There may be discrimination along the way. So all of these factors can be compounded by social isolation and being away from the family. And you can see how all of these can leave people feeling quite vulnerable to mental health problems. And then if we look at fourth generation displacement due to war, for example, which is again a common theme in the world at the moment, people often experience trauma, loss of property, livelihood, and forced migration. So again, the mental health issues here are not just emotional problems. They can be much more fundamental than one of survival, safety. So you can see how migration, both planned and unplanned, can be quite a driver for mental health vulnerability. And we are seeing the impact of climate change more and more. Natural calamities like earthquakes, tsunamis, flooding, again, they cause a loss of livelihood, loss of property, loss of life. So people are exposed to grief and trauma, and again, forced displacement. So all of these factors, I think, are quite significant in making people vulnerable to mental health problems. A growing concern due to climate change is also global warming. And there are studies now that are pointing link between global warming and various more serious mental health problems, including suicide. So these are some of the recent sort of emerging trends, and you can see how they affect both people at an individual level and also at a community level. So I think we need to be aware of these growing concerns.
Thank you, Dr. Kiran, for sharing that. You talked about displacement as well as in the adolescent period, digital, the way the world is digital now can also have a huge impact on the young population specifically. A follow-up to that question is about work. Our focus or target group in Uplifther is women who are in the working age population. And we've seen how work impacts how people think of themselves today. We often match happiness as well as success with career success. And so, my next question to you is how do challenges like job loss, workplace stress, or even being underemployed affect someone's self worth or sense of purpose?
That's an excellent question, Ayushi. And um, um, all of those things, work-related stress, underemployment, and unemployment, they all affect mental health, slightly different ways. Um, so, work-related stress, if one is exposed to stress at work all the time, their work shifts from being sort of meaningful to becoming something which they have to do for survival, to meet their very basic needs for food, shelter, and such things. So when one loses meaning in the workplace, and there are constant demands of deadlines, uh, having to be more productive at work without carrying a meaning with it, people can become burnt out. And I think a burnout at work is a significant factor these days in loss of productivity, exposure to mental health problems like anxiety, depression, that can be of varying degrees, including suicide as well in some cases. So the I mean, underemployment is a slightly different problem, because I know how important this particular topic is to you personally, and in your research. Underemployment is where one is in employment, but it does not really use their full skills or potential to the fullest extent. So this mismatch can weaken people's sense of purpose, because they're not able to grow or contribute in ways that feel meaningful to them. And it can also affect people's sense of self-worth. Um, and sometimes if people are then comparing where they are with some of their peers who may be doing much better, it can affect their sense of self, and who they are as an individual. And you can imagine how all of these factors can then expose someone to anxiety, depression, emotional difficulties, and that can also be compounded by relationship problems, and so on. So I think underemployment is a slightly different challenge, but with quite significant impact on people's mental well-being. Unemployment, again, unemployment is probably the worst of the lot, because you've got someone who is not in work, because as you said in your introduction, work can define someone's life in some instances, even if it doesn't define their life completely, it would have a significant contribution to their sense of self. Um, um, so so not having work, not being able to find work after they finish university or their training, vocational training, or losing one's job, can have a profound effect on someone's routine, their sense of purpose in their day-to-day life, and again, it can expose them to varying levels of mental health problems. And I think, on the whole, to what extent somebody is affected depends on how much they value work as part of their identity, what level of social support they have, what importance work carries in their culture or communities, and what level of support they have in their workplace or from their family and friends. So, so yeah, it can vary, but all of these factors do impact on mental well-being.
And thank you for that. And the next question connects this question with how someone in the psychiatric setting will approach such a problem. Because, first of all, it's
Hmm.
multifaceted. It's hard to even quantize. Like when I was doing my research, I could not quantize underemployment. It was very hard to do that. For that, we had a scale that was introduced, and making that scale itself was a difficult process because of the varying nature things. You even said in your answer that it also depends on how important they took work in their lives to be. Like, was work their first priority, or did they have something more? They had a different priority in life. It depends on what they prioritized and stuff like that. So, how would someone in the psychiatric setting approach problems that are related to the workplace, related to work stress, as well as underemployment?
Yeah. Again, I think it depends on the overall picture and the context. But if I talk about it from my own clinical experience, where I work, so in the UK, and in many places in the Western world, particularly, mental health is delivered in multidisciplinary teams. So I would be working with a range of colleagues, people like social workers, occupational therapists, employment specialists, housing and finance advisors, and so on. So I would have access to a range of skills, and competencies in supporting someone like this. But the first and foremost thing is to understand and empathize or validate the person's circumstances, because for many people, losing or struggling with their finances isn't just a practical problem. It can totally shake their sense of self-worth, and their purpose in life. So acknowledging that upfront can be a very powerful way of actually demonstrating that you really truly understand what they're going through. So I think the next thing you would do is to try and explore the impact of that, um, um, because people may sometimes blame themselves personally for things that they're actually not responsible for. And then helping them separate out factors that are not outside their control, that may have contributed to their predicament, and then just reframing the situation in this way can again be quite helpful in engaging the person, and relieving pressure off them. The next thing I would do is to work with my colleagues with the right skill set to support the person with some very practical steps and coping strategies. And they would be with the view to creating some sort of routines or restoring routines that may have been lost, some very practical stress management skills, identifying their strengths, past successes, so they're able to rethink what's possible in the future. And they can be quite a confidence building measure, and help someone with a sense of actually agency, to do something about their problems. And then working with employment specialists, looking at possible alternative job opportunities, searching for jobs, producing a CV, thinking about gaps in skill set, getting some guidance around their finances, if they are in debt, if they need some advice to do with their social welfare benefits. Offering those sorts of opportunities and guidance can be quite valuable. Obviously, you have to be careful that you are not um, um, taking away the person's own initiative in grappling with their own difficulties. So you'd give them a hand, but not necessarily solve their problems for them, because that can de-skill someone who is already feeling quite vulnerable. And then you should also be thinking about the longer term perspective, about how to build resilience, or ability to cope with future similar situations. So this is a comprehensive sort of approach, and you would be using a range of colleagues to support the individual.
Yes, because it's definitely a multidisciplinary problem, and that's why we need people from various areas. We need career coaches as well as psychiatrists, maybe to come together, because a career coach will talk about the workplace aspect, and a psychiatrist will talk about how it's impacting their emotions. You also talked about how it was important to validate and sympathize with your patient. And my next question is attached to that. You've spoken about how central empathy is in psychiatric practice. So, how do you feel empathy and genuine understanding influence recovery and strengthen the bond between a patient and a psychiatrist?
Yeah. Okay. Yeah, I think we have spoken about it in the past as well. I mean, empathy is about putting yourself in someone else's shoes, and then recognizing what they feel, and responding with care. So I think, in my experience, when a doctor acknowledges a patient's feelings, it validates their experience and reduces emotional stress. Um, And patients who feel understood are they're more likely to be open about their symptoms, and that would allow for more accurate diagnosis and personalized sort of treatment planning. And I think empathy can help every step of the way in a doctor-patient journey. So right from the first time you meet, when you try to understand and diagnose a problem, right through to when you've made a plan and you are expecting that that plan is followed, to treatment outcomes. So, for example, where a patient feels they are validated and empathized with in a consultation, they're more likely to follow the treatment plans. So when it comes to taking the medication correctly, or making some sort of lifestyle changes, introducing some dietary changes or exercise or certain manner of self-care, all of those things can be influenced by empathy. So once patients feel more able to connect with you, and there is that sense of safety and trust, it can build sort of resilience during more difficult times. And sometimes in my clinical practice, you may have to have some difficult conversations with the patient, if there are concerns about, say, for example, non-adherence to treatment. And those conversations can be made easier if you have built a strong therapeutic relationship through empathy. And it also improves sort of trust and communication. And people who feel empathized are more likely to collaborate with you in their care, and take on more personal responsibility as well. And what I mean by that is, a lot of what we do is also geared to prevent future problems. So it is not necessarily the problem right in front of us. It is also about doing things to prevent future problems from occurring. And empathy can instill a sense of sort of future proofing in people. So it is a vital tool in a healthcare professional's toolkit, and it has the potential to transform somebody's care and treatment.
Thank you for sharing that. My last question is actually on a personal note. For those who don't know, our viewers, Dr. Kiran Pindiprolu was my mentor for my research project. And so, my last question is, since you mentor so many young people, what guidance would you give to future mental health professionals about balancing scientific rigor with compassion?
I think everyone will have to find their own balance, but balance is a crucial word, because you have to have a range of things in your to be able to successfully balance academic pressures with your personal life. And I think the first one is to sort of study smart, use certain techniques to plan your days and to make sure you are focused in your sessions, and you learn without having to stay awake all night. So the other one I would emphasize is to take care of yourself. So making sure you're getting enough sleep, you're getting enough exercise, and mindfulness is something which is now showing more and more evidence for mental well-being. So doing some mindfulness, even if it is for a few minutes regularly, can go a long way in improving your energy and focus. And the third one is to plan your time and to have boundaries. So you have a schedule for your tasks, but also protect time for relaxation. The last thing I would say is to have a support network that you can lean on, friends, mentors, um, um, family, so you don't feel completely overwhelmed. I think having things to do outside work is so critical, really. So hobbies, interests that you can equally enjoy as much as your studies. So you are balancing the both.
Thank you so much for talking with us today. You added a lot of thoughtful and generous insights, which we will value. Um, this conversation with you added a lot of depth to the work we are doing here at Uplifter. And to have your voice in this space was a very pleasant experience for us, and it was needed as well. To everyone watching this recording, if you found meaning in this conversation, please support Uplifther by sharing it with women who may benefit and by joining our awareness campaign. Together, we will reach more women to whom we can support with both understanding as well as encouragement. Thank you so much, Dr. Kiran, and thank you to everyone watching. Thank you.